Now coming to the thoracic vertebrae, we have 12 thoracic vertebrae. Of the 12 thoracic vertebrae, vertebra T2 to T8 are typical. That means that they have similar features. And the vertebrae T1, T9, T10, T11 and T12, they have different features. So they are atypical. We are going to discuss typical and atypical separately. Now coming to a typical thoracic vertebra. A typical thoracic vertebra has a heart-shaped body, as you can see, which is broad from side to side. Then the vertebral foramen is rounded or circular. The pedicles are broad and attached to upper part of the body. Hence, the inferior vertebral notches are bigger than the superior vertebral notch. The superior notch is shallower in comparison to inferior notch. Then coming to the lateral masses or the transverse processes, they are directed backwards and laterally. The transverse process has a facet anteriorly for the articulation with tubercle of the corresponding rib. The typical feature of the thoracic vertebrae is that the body bears facets, the demi-facets or complete facets. They are two in number. This is the superior facet and this is the inferior facet. The superior facet articulates with the corresponding rib and the inferior facet articulates with the rib below it. Then the superior articular processes are facing backwards and the inferior articular processes are facing downwards and forwards. They have the facets, the inferior articular facet and the superior articular facets for the corresponding vertebrae. Then the spine of the thoracic vertebrae is pointed, long, and it is directed downwards. It is not horizontal, it is directed downwards. Now coming to an atypical thoracic vertebra, let's discuss T9. T9 is different from other typical vertebrae that in the sense that it has only one facet, the superior articular, the one demi-facet on the body of the vertebra for the corresponding rib. It lacks the inferior facet since the ribs have ended here. Otherwise, it is similar to other typical vertebrae. The spine is a little more facing downwards in comparison to the other typical vertebrae.